Skill 21 provides perineal care, Peri-Care for female. The materials that you will need for this skill is 1 pair of gloves, a basin, perineal wash, 6 hand towels, 2 chucks, 1 imaginary privacy blanket, 1 imaginary towel.
Knock, knock. Good afternoon, Mrs. Smith. My name is Chris. I'm going to be your nursing assistant today, and I'm here to perform perineal care. Is now a good time? I start off by washing my hands. I confirm the identity of my patient with her wristband, or I ask the patient to repeat her name back to me. I will fill my basin halfway with warm water, check the temperature with the inside of my wrist, ask the patient to check the temperature with her fingers. Mrs. Smith, is the water a good temperature for you? I will provide privacy. I will check that the wheels are locked on the bed, and I will raise the bed up to my waist level. Prior to touching my patient, I will don on clean gloves. With clean gloves on, I can now place the imaginary privacy blanket, spread it over the patient. I will be using this as a visual aid so I remember to get rid of it later. I will roll down the patient's clean sheet and get ready to turn the patient to the side. Now, when placing a chuck under the patient, you can also have the patient bridge their hips. It's up to you. I will move the arm out of the way. Cross the closer arm over the chest, flex the closest knee, but you can also choose to cross one foot over the other. Mrs. Smith, on the count of 3, I need you to turn towards your side. Are you ready? 1, 2, 3. I'll be exposing the area that I'm going to be working with, which is going to be the perineal area. And I will take my bed protector, or chucks, and place it under the patient's perineum. Mrs. Smith, go ahead and turn back towards me. From here, I can take the privacy blanket and the patient's gown and turn it inward to protect the gown from getting dirty or contaminated during care. I will also be placing an imaginary towel from the knees down, so that way the only area that we're exposing is the perineum. I will place the patient's feet in a dorsal recumbent position. Now, this is a mannequin, and sometimes they will not stay in place, so as long as we say that they're in the dorsal recumbent position, we can inform the proctor that the patient's legs don't stay, and we can move over to a butterfly position instead. From here, I will take my first wash towel, fold it into the 4-leaf method, submerge it in the water, remove excess by wringing it out, applying perineal wash to all 4 leaves. With my non-dominant hand, I will separate the labia with my index finger and thumb, and I will start off by cleaning the side farthest away from me. So from top to bottom, labia farthest away from me, avoiding the rectum. I change my leaf, spread the labia apart again, closer labia from top to bottom, avoiding the rectum, changing my leaf, spreading the labia apart, center line from top to bottom, avoiding the rectum. And my 4th leaf will go across the pubis and down the inguinal portion of the inner thigh, being very obvious, going from top to bottom, front to back. Disposing of this in the dirty linen. Second hand towel, I will submerge it in the water, remove excess. 4-leaf method again, rinsing with the same technique. Spreading the labia apart. First leaf is the labia farthest from me, from top to bottom, avoiding the rectum. Changing to my second leaf, spreading the labia apart, closer side from top to bottom, avoiding the rectum. Changing my leaf, spreading the labia apart, from the top of the center line down, avoiding the rectum. Fourth and final leaf will be the pubis and inguinal area of the inner thigh, being very obvious, going from top to bottom. Dirty linen. Third hand towel will be to pat dry in a zigzag pattern, going from top to bottom, going down gradually, avoiding the rectum. Disposing of this into the dirty linen container. Now we will be turning the patient to the side to perform rectal care. We'll readjust the patient's legs to comfort, cover them back up with their privacy blanket and their gown. Before having the patient turn to the side, opposite arm goes out of the way, straight up. Closer arm flexed across the chest. Closer leg will be flexed, or one leg can be crossed over the other. We're going to have 2 points of contact, the shoulder and the hip. Mrs. Smith, on the count of 3, I want you to reach for that guardrail. Are you ready? 1, 2, 3. Exposing the area that I'm going to be working with, which is going to be the buttocks and the rectum. Next, I will perform rectal care. I'll take my fourth hand towel, or if you only want to use 3 hand towels, you have to tell the proctor that you're grabbing a new set of 3 towels. So minimum is 3, maximum is 6. Fourth hand towel, submerge it in the water, remove the excess. We're going to apply perineal wash to all 4 leaves. And we're going to perform rectal care twice. We're going to clean each buttocks once. Starting with the rectum, we're going to start directly on the rectum and go straight across. Change your leaf, starting directly on the rectum, straight across towards the waist, away from the perineal area that we just cleaned. Change my leaf to the third one, start on the base of the buttocks, top buttocks, straight across towards the back. Change my leaf, base of the buttocks, straight across towards the waist. This will be disposed of in dirty linen. Fifth hand towel, we're going to submerge it, remove excess water by wringing it. We're going to clean and rinse the same way. Starting on the rectum, straight across to the waist, changing our leaf, one more time, rectum to waist, changing our leaf, top buttocks from the base of the buttocks, straight across, changing our leaf, base of the bottom buttocks, straight across. Disposing of this in dirty linen. Third towel, or sixth towel, will be simply to pat dry, no 4-leaf method. Start on the rectum, patting dry towards the waist. Base of the top buttocks, patting dry towards the waist. Base of the bottom buttocks, patting dry towards the waist. Dispose of this in dirty linen. Take our dirty chucks pad and roll it towards the patient. And if the patient's not on top of it, you can remove it, or you can simply have the patient turn back towards you. Mrs. Smith, turn back towards me now. Adjust the patient to comfort. At this time, you can walk around to the other side, or you can just simply lift the opposite hip and remove the chucks pad, like so. Discard of this into the trash. The last thing that we touch with our contaminated gloves when it comes to the bed is the privacy blanket and the imaginary towel. Now I can discard my station. I will empty, rinse, and dry, and place my basin in the dirty supply area. My perineal wash will go to its designated area. And the barrier or chucks pad will go to the trash. I will doff my gloves, throw them away in the trash. and wash my hands. Return to my patient with clean hands now. Make sure the patient has his call light or her call light within her reach. Cover the patient back up with a clean sheet. Lower the bed to the lowest level. I will confirm that the wheels have remained locked. I will remove the privacy. I will wash my hands again, report and document, and my skill is complete.